Hi everyone, my name is Grace Cioffi. I'm a third-year student at Sacred Heart University in Connecticut. I'm on the student council for APTA and I have a specific interest in neuro, so I'm here with today.
I'm Gillian McLean. I am a physical therapist. I also have a board-certified specialty in neurologic physical therapy. I did my DPT education at Wingate University outside of Charlotte, North Carolina. I did a neurologic residency at Ohio Health with Ohio University. I practiced in pretty much every setting. I now am a PhD student at the University of Illinois Chicago and an assistant professor at North Central College in their physical therapy program. I'm on the membership and PR committee for the Academy of Neurologic Physical Therapy.
Well, with all of that being said, I think my first question for you is, how did you get involved in neuro PT specifically in the neuro section?
Yeah, I just love the neurologic population. And so right off the bat, I knew that these were my people. I love that we really make a huge impact in these people's lives. Every physical therapist does, but we really take them from a lot of times like the worst days of their life and give them quality of life again. And it's just like a fantastic journey to be a part of and show them that there can be a good life even though it looks different than it looked before.
What does a day in the life look like for you in the neuro section?
Yeah, I've worn a lot of hats throughout my career as a clinician, either in inpatient rehab or outpatient. You have a variety of patients. So you could have a stroke, you could have spinal cord injury, we could have vestibular, there could be Parkinson's. So just prepping to make sure you're ready for each individual type of patient and where they're at on their journey. And then doing your patient care, collaborating with OTs, speech language pathologists, physicians, a lot of interdisciplinary care in neuro. We really don't work in a silo and I can't do my job alone. Now in academia, I am prepping for my lectures and labs as a neuro professor, maybe working in acute care, prepping our clinical practice series where we bring in real patients or have cases. And then as a PhD student, going into the lab and looking at research in the neurologic population to improve how we practice.
That is a very busy schedule, definitely lots of different demands. So I think that begs the question, what are the types of qualities and characteristics that a neuro PT has? You know, it's definitely, I can imagine someone who is very versatile. So can you speak to that a little bit?
Yeah, I think flexibility is one of the biggest things that we have to have because you could think your patient's gonna come in one way and they could either be way worse, way better, or maybe just how you thought. So I always say try to have 3 plans for what you're gonna do that day. And then just having a lot of compassion. I think that's what we have to lead with, compassion, because these people come from all walks of life, maybe things we don't know about, but just listening to their story and truly looking at what the goals they have. I know as PT sometimes we can be a little bit more of an ableist. So is that what they want? What does the patient want? And so being able to really give them that level of care, I think is something important for the neurologic clinician.
Awesome. I know that neuro PT has such a great depth to it. I feel like learning about it in school, there is so much more out there than I once originally thought. So what types of resources does the neuro section have for students? You know, what type of education do they provide? How can students learn more about this population?
Yeah. There's so many resources on the neuropt.org website for our academy. We have a lot of EDGE documents for each patient population, all the different outcome measures that are recommended to be used in like every different setting in research. So it's nice, like easy, okay, I have a patient with MS coming in today, an outpatient, what are the outcome measures I should look to do? And it's right there for you, which makes our job a lot easier. And then there's clinical practice guidelines, and then we have resources to make that even more accessible. So with the locomotor training one in stroke and complete spinal cord injury and brain injury, there is a calculator for heart rate, and there's a graph there for you, or a chart, so you can be like, okay, this person is 35 years old. This is the heart rate I need to be, that 75% intensity. And then they also have a light on the back for like, this is the green light, maybe some caution, and they should not do high intensity gait training with these people. So there's a lot of resources to make what we do at a very high level very accessible. Evidence Elevates is another one of our campaigns to really get evidence into our practice. And so it's become a lot easier for all the things we have on our website. And there's also a mentoring program. You can sign up for the mentee form and they'll match you with a neurologic clinician that wants to mentor, and you can have a little bit more hands-on guide to get to your goals.
Awesome.
Yeah.
Cool. I think my next question would be, what types of opportunities are there for student involvement in the neuro section? You know, if a student is really passionate about all of these resources that are provided by the neuro section, if they have an established interest, can they get involved early?
Yeah, I would say the biggest place for them is within our special interest groups. So we think we have 6 or 7 of them: brain injury, stroke, vestibular, degenerative diseases, balance and falls, assistive technology, and seating mobility, residency. A lot of them need help with certain resources that they're creating, maybe with social media. So a lot of times the SIGs are a great way to get into the academy, and then from there kind of connecting through different clinicians and different leaders and finding your path there.
Awesome. Where do you see the neuro section headed?
I think we're just going to continue to have really high level evidence that's accessible to the everyday clinician. I think we do a fantastic job of making, maybe more complex research into something simple to implement into your practice. So giving you the tools in order to have the knowledge translation, so we don't take 17 years to go from article to practice. You can get it a little bit faster and get our patients optimizing our visits there. Yeah.
Is there anything that you found that kind of differentiates the neuro section from other sections within the APTA, either with where we are now, or as you were just mentioning, like where things are headed?
I think honestly, just the amount of resources, free resources you have as a member is unreal. I feel like a lot of the other academies, there's not just quite this many handouts and things you can print up around your clinic and disseminate information, and just like a pathway in order to help you be a better clinician and teach everyone around you. I think everyone that I've met so far is willing to have a phone call with you if you have a question about what they're really good at. And just accessibility to everything within our section, and just the resources I think are just nobody else has those.
So I think one of the big questions that we haven't really talked about yet is, as someone who's transitioning from being a student to being a clinician, how do you take the initial step in neuro PT? What are the different paths to becoming involved, and how are they different from each other?
Absolutely. I think one of the first steps, if you can get a clinical rotation in the neurologic setting, whether that's acute inpatient or outpatient, is a great way to get your foot wet and figure out if that's the path you want to take. And then if you can, pursue a neuro residency, but that's not for everyone. It's a lot of work. There's a little bit of a pay cut that's involved with that, but it is 3 to 5 years of experience in that 1 year in your residency. I really value the education that I got in my residency, but I also know it's not in everyone's path. You can also get a job as a new grad in many of the neurologic hospital systems or clinics, and then trying to get mentoring from the other expert clinicians that are in those clinics. And then from there, you can take the NCS either way. You either take a residency or you do 2,000 hours of specialty practice, and you can sit for the board exam to be a board certified clinical specialist if that's what you want. But I think just embedding yourself in the neuro world and just learning as much as you can from the expert clinicians around you is the best way to get into neuro.
Do you find that there are significant differences in neuro PTs across the continuum of care, or do you find that, for the most part, some of the same practice values are standing throughout the continuum?
Yeah, I feel like those of us that were residency trained or have been in the world for a long time have a lot of the same values of high intensity. Is something I've noticed from those of us have been trained within the last 5-10 years. High intensity is a huge part of what we do. So we're just cranking out how do we make their heart rate get higher and really generate that neuroplasticity across. And then we've really done a much better job with outcome measures across the continuum of care, make sure you're scoring whatever it is in acute care and then tracking it as they continue. So you can really show the patient, insurance, payers, hey, we've really been making a lot of progress. We really need to continue seeing this patient, trying to really justify our care so we can keep seeing them and optimize their recovery.
Awesome. I think another question too is, if you had to kind of leave students, and early clinicians with just a few words or some key resources that they can reference, what would you suggest?
My biggest suggestion is to lead with your passion. Whatever in PT lights that fire within you, follow it, because that's what's going to drive you through the days that really just suck. There's never going to be a perfect job. There's going to be days that you're just why am I doing this? And remembering what that passion is that fuels you forward, and reminding yourself of that all the time. And if you really are interested in neuro, neuropt.org is a great place to just search whatever you are curious about. There's a list of all the residencies there, or all the mentoring, the mentee forums are there. It's a great place to start. And then just reaching out. If you see somebody on Instagram, on X, it's no longer called Twitter, or Facebook, just reach out. Most people are really accessible and they would love to answer your questions. So not being afraid to take that leap and just ask somebody a question can be a great place to start.
Cool, thank you.
You're welcome.